Marvin Goldfried is a distinguished professor of psychology at Stony Brook University, where he helped to develop the graduate program in clinical psychology. He's the co-founder of the Society for the Exploration of Psychotherapy Integration. Alan Francis is a professor of psychiatry and chair emeritus at Duke, and was chair of the DSM-IV task force. Marvin describes the evolution of his psychotherapy orientation as psychodynamic, behavioral, CBT, and eventually integrative. He practices, teaches, and supervises what works clinically using direct and indirect evidence base. Alan describes his approach to psychotherapy as whatever works, or no one size fits all. He was trained and taught at the Columbia University Psychoanalytic Center, but remains equally interested in brief, supportive, cognitive, behavioral, interpersonal, and family therapies. Please enjoy this week's episode.
Good morning and welcome to Talking Therapy. I am Marvin Goldfried and my colleague here is
Alan Francis. And actually, I realize that for people who are watching this, there's a wonderful lighting effect. I don't know whether you did this deliberately, Marvin, or whether it just happened because it's deserved, but there's a halo shining behind your head. And I think that after a lifetime of great service to humanity, no one deserves to have a halo more than you do.
Oh my goodness. Well, thank you. That is very nice of you. So we're going to have to get you a halo somehow.
I don't deserve one.
I don't deserve have a light bulb behind you and be backlit a bit. And I think that
I deserve to live in darkness.
Because you're old, and that's our topic. You're in the dark.
I am old, and I guess that's what we're discussing today, right?
Right. And old people change.
We're experts on this.
Yeah.
From experience.
I'm not the same person I was growing up in Brooklyn. I'm not the same person I was 5 years ago. So it's not terribly hard evidence, but I think there is evidence that people can change. How about you?
Well, I would say that I'm as immature as I always was, maybe gradually even more so, but that aging forces you to change. That you don't have a choice. That as the indignities of aging gradually progress, if you're not able to adapt to your changing circumstances, your changing abilities, your increasing aches and pains, your inability to remember names, you're constantly losing things, your loss of friends, family members to death and disease. If you're not able to change as you get older, you're in real trouble because it requires new forms of adaptability. Right. Because the stresses are so different.
The jargon for this is developmental tasks. In the field of child psychology and development, it was always pointing to the different developmental tasks that existed at different ages. You know, learning to dress yourself, learning to care for yourself, and things like that. So what you're saying is that as we age and our life circumstances change and our bodies change, there are different developmental tasks that we never had before. Like putting on your pants while standing.
Erik Erikson described different stages of life, and for aging, he said the essential developmental task was maintaining integrity instead of developing despair.
Which is very hard to do for anybody at this point in time of our society. But it's kind of interesting because Freud said, you know, you reach adulthood and that's the end of development.
And that's exactly what Erikson was doing. He was expanding the model to find the particular challenge at each stage of life and what would be the penalty if you weren't able to meet that challenge.
Yeah. Did I ever tell you I went to a small conference of about a dozen people sitting around the table, and I sat right next to Erikson.
Oh, wow.
It was a wow, yeah. It was a conference on coping skills. And for some reason, I was invited, but I was sitting right next to Erikson, and he was a real person.
He was a mensch?
I don't know. He didn't speak very much. Anyway, I think this is important. I think, the Freudian notion of development stopping at adulthood and the fairy tales that we grow up with, where people live happily ever after, does a disservice to lots of people. But in many ways, and it's not just aging, it's like people don't live happily ever after for the most part. There's always stuff going on. But the whole notion of aging and development, clearly it's becoming more to the forefront now. But if you look at old textbooks, the textbooks were child development. Developmental course ended with adulthood. And so our mentality was not to pay much attention.
I remember, Marvin, when we were on the NIMH committee that was funding psychotherapy grants 40 years ago, some of the psychotherapy grants that we saw were psychotherapy of the elderly.
Yeah.
And as I recall it, one of the comments that came up in the group was, can old people change? The topic you're picking up today was one that we were discussing then. And as I recall it, we did fund 1 or 2 grants and focusing on psychotherapy of the elderly.
That's interesting. I don't recall that, but I think, it's not only the theories that we've been taught that have caused us to not pay enough attention to the elderly, but I also think we don't want to talk about the elderly. There's an invisibility. Pay no attention to that person behind the curtain. That kind of person who's hunched over, who has difficulties in functioning in some ways. And I don't want to pay attention to that because I may become that person someday.
Soon. Me too.
Well, we are there now. I mean, we're there. But when we talk about racism and discrimination against sexual minorities and sexism, ageism, we don't talk too much about that.
And 2 ways that this is most obvious. One is the shame of nursing homes in America, how terribly understaffed they are, how people are warehoused, given little respect or dignity as individuals, and the COVID death rate, the fact that there wasn't an immediate effort to harden the target to make sure that everyone over the age of 65 received shots, that we have a tendency to neglect the most vulnerable populations in our society. It's interesting. The elderly now are very wealthy. That there's never been a time when the elderly had such a share of national wealth, but at the same time, never have the elderly been so neglected, particularly those people who don't share in that bounty.
Except in commercials. What I'm finding, I don't know whether you see that, but early morning commercials very much cater to the elderly and the bodily and the mental problems that occur. But I have to confess something. Full disclosure: I suffer from ageism. I discriminate against the elderly. That's the way I was brought up. I think they have nothing to offer. I make an exception in your case because we know each other for close to 50 years. And I'm getting better at it as I get older. I'm becoming more accepting. But the fact of the matter is, we're brought up, not in, at least in our society, not to respect the elderly.
It's interesting. The person I loved most growing up was my grandmother, so I don't have that attitude.
Well, the notion is, or at least my view of it, and maybe this is idiosyncratic to me. I grew up with my grandmother also. But what she would do is she would sit next to the window. This was before television, and watch the people go by. That was her activity. I mean, she did some cooking and things like that, but basically she, quote, didn't do anything.
Mm-hmm.
Didn't do anything worthwhile according to our standards of our society.
So we've identified the problem. What's the solution?
Okay. Well, there's more to the problem also. If we go back to Erickson and he talks about adolescence, late adolescence, early adulthood, and the whole notion of identity crisis. He says, my recollection of it is that he says that one of the ways in which we resolve our identity crisis is through our work. We become a therapist, we become a psychiatrist, we become a psychologist, we become a physician, we become whatever, and that becomes our identity. And then the problem that occurs is called retirement. Then what are you if you're no longer any of these things? And I think this is an issue. And I've seen this as an issue clinically with some patients. Very high functioning people. I saw one person, won't identify whether it's even a male or female. That person has achieved a great deal in their life, and at a certain point became extremely depressed. It was, quote, treatment resistant depression, which is, I know, a hot topic as to whatever that means. It's like nothing it's the patient's fault that they're not grateful enough to benefit from the treatments we offer, or we don't know how to treat them. Anyway, this gal was very depressed. Meds were not working, and it was a question of whether they were a candidate for ECT. And the person was referred to me, and I identified the problem as the loss of identity, which was so very important because this person had a very bad childhood, and their career made them feel so much better, and they no longer had that. And we worked on that, and we used, as a matter of fact, 2 chair work. They got better. So I think identity is an issue that we're likely to see in any work with elderly.
The Japanese have a particularly vivid way of describing this sense of sudden loss of identity. When the man retires and is staying at home with little to do, he's called big garbage. Someone who went from being the paterfamilias, the head of the household, the moneymaker, the decision maker, suddenly has no use, no role, and is called big garbage. And we don't have the name for it. Very often the phenomenon occurs here as well. I think part of the issue is, in the United States, there tends to be a pill for every problem. And the most over-medicated group of people in the United States are the elderly. This is certainly true with medicines for physical health, also true for medicines for mental health, so that we have a ridiculously high percentage of elderly getting benzodiazepines, 8%. We have a ridiculously high percent of elderly getting antidepressants. And even worse, we have a ridiculously high percentage of the elderly getting antipsychotics in nursing homes, where there's not enough staff to take someone to the bathroom. And if someone complains, they're given diapers and antipsychotics rather than an adequate degree of respect and help in having their needs met. So I think we're medicalizing old age on the mental health side, giving medicines that are much more dangerous in the elderly than they are in any other population, because elderly people do not easily excrete or metabolize these medicines. They tend to have doses that are no longer appropriate. The medicines interact with one another and cause behavioral side effects and also increase blood levels. Whenever there's a new symptom in an elderly patient, the first thing that needs to be asked about is whether this is a medication side effect, a side effect either of mental health medicine or of a medicine for their physical health.
But the medication for the elderly is really to soothe the staff so that the staff feel better and less hassled. It's certainly not for the patient. Well, can people in nursing homes change? Do you remember that study that was done some years ago where they took a floor of a nursing home and they had people, the residents there, take an active role in picking out pictures, picking out curtains, of getting plants and flowers and taking care of it. They were very, very active in making an impact on their lives. And they gave a control floor, the same stuff that was done on the experimental floor where people were making an impact. So that they got the flowers, they got the curtains and everything else. And the people who were responsible for their own lives on the experimental floor lived longer.
Pets also help a lot. Plants, having living things around. I think the British have a great term for this. They call it social prescribing.
Yeah.
That instead of prescribing a medicine, to prescribe some change in the person's activities, relationship to their environment, that makes their life much fuller and provides meaning where previously they were just looking out a window or looking at a blank wall with nothing to do.
You want to hear my primitive theory about all of this?
What do you think?
The image I have, get this, there's a crib and there's an infant in it, and there's a toy hanging from the ceiling, and the child either kicks or touches the toy, and it moves, and the infant laughs. This is it. Making an impact on your world starts at a very early age. We call it all kinds of things. We call it self-confidence. We call it self-efficacy. It becomes much more complicated. It's likely to make an impact if you're not given the opportunity, or if there are things that come with aging, like memory.
I think we have to balance the discussion so far, which is focused on the dark side of aging, with the other experimental finding that's counterintuitive, and that is that people get happier as a group as they age out of middle age. The peaks of happiness are young adulthood and after retirement.
Because they do more of what they want and care less of what other people think.
And have less to lose. So there isn't the same pressure to accomplish. There isn't the same competitiveness, more acceptance. So that we have to see two sides of aging.
Yes.
On the one hand, for many people, it's a relief to have acquired the opportunity to relax, to enjoy activities they previously had no time for, and the relief of the pressure of performing. For other people, particularly as you advance in age and as your physical and mental status that degenerates, it's a much more challenging time. And I don't think they do these studies on people our age. I think generally when they're talking about the happiness, it's the younger seniors.
Right.
Not the over 80s and over 90s.
I'm going to reflect my age by asking you, did I tell you the story about my looking at the sky at my country house?
Go for it.
I'm asking you. You're probably, even if I said it.
I wouldn't remember, Marvin. I don't have.
Okay. Oh, I repeat myself.
My memory is very compromised.
Yeah, so is mine. Anyway, I was sitting with my feet up on a lounge chair on the upper deck, looking down onto the lake and looking at the sky and just looking at the lake. There was nothing on the lake, actually, but I was just looking at the lake. And then I heard my father's voice. And he said, "What did you accomplish today?" And very defensively, my thought was, how could I answer that? I said, well, I'm watching the lake. I'm watching the lake to make sure that nobody takes it. So far, everything's okay. I just couldn't enjoy the lake without having that thought of accomplishment.
I think I was luckier than you, Marvin, in the sense that in my life, I never worried about accomplishing things that much. And I don't mind being lazy and selfish now and just sitting at the beach. But I think that what's essential for a happy end of life experience, old age and end of life experience, is good minutes, is finding moments that people can enjoy without guilt, without second guessing about, should I be enjoying this? And I guess one of the things that we should be discussing is how do we help people have more of these good minutes?
Yeah.
And also we should be discussing what is the psychotherapy of people who are elderly.
Yeah.
Well, what's the best approach in helping them with their problems?
No, good point. Okay. The notion of this, of what we get, a benefit of aging, which involves change. And that is, we become, our view of the world changes in a way. The meaning of any event changes because the meaning of an event depends on the context. And the more context we have to place an event in, such as missing a bus, is placed in the context of having major surgery and recovering. Having major surgery is much more distressing than missing a bus. So the more experience older people have, the broader the context, or the more texture the context of any given event, and things are not as terrible as they used to be. And I think we call that wisdom, we call that acceptance, we call that, a number of different things.
I love the Charlie Chaplin way of expressing this, that quote, that life is a tragedy in close-up and a comedy in long shot. And that old people have a longer kind of perspective about life and are able often to have a greater acceptance for the slings and arrows because they've experienced so many of them and realize that they're not catastrophic.
And, there's a whole notion of post-traumatic stress change as a function of post-traumatic stress, where you've gone through things, and if you survived it, you become different. And can the elderly change? Look at Ted Kennedy. Remember Ted Kennedy and his earlier lives? Drinking, carousing, cheating, all kinds of things. And then became an elder statesman that was very dedicated to the welfare of people.
Yeah, I think that's what makes old age special and wonderful. The ability to help others, to be disinterested, to provide advice, the village elder phenomenon, to be able to maintain your integrity in Ericksonian terms by providing others with the gift of wisdom.
Yeah.
I think the other thing I'd like to bring up is how does a therapist deal with someone who's elderly, or how does a caretaker, because people listening to this may have their own relatives who are getting to our age in life.
The whole notion of caregiving, that's a whole other ball of wax. I don't want to get into that, but I think it is important because more people are caregivers, and we don't.
Well, I think that one of the things that's crucial to understand is how valuable it is for elderly people to be able to discuss their lives. It's valuable to them, and it's valuable to the people who listen to them.
Yeah.
And the regret I've heard throughout my career when someone dies is, I wish I had asked them more about themselves.
Yes.
I wish I'd gotten to know them more.
Yeah.
And I think that one of the things that's very valuable for any therapist who's working with a senior or any person who's caring for a senior is, don't lose the opportunity to get them to know them well, to get to know what they're feeling now, to get to know what their life narrative has been, to get them to speak about themselves and to remember things. That just the act of doing that is very helpful for the person doing it, and I think also very helpful for the listener.
Yeah. And the CBT person in me says, yes, in addition to knowing, also doing. Having them do something they've never done before, but wanted to before while they still can. So I've been working with somebody where this person was closeted in their sexual orientation for their entire life, because in the profession they were in, it would have been disastrous if they came out. At age 80, that person married somebody of the same sex. Can people change when they're old? Yes, they can. If
And there's
you
evidence.
know, if you know, what's important for them to do.
And there's evidence that the best way to inhibit dementia, the best way to maintain intellectual functioning, is it's certainly not a pill. There's no pill for dementia. There's no pill that helps to improve cognitive functioning in the elderly. The best way is to do new things, to stay interested, to be socially engaged, to develop new interests, to develop new skills that keeps the brain young, not just in terms of mental functioning, but in terms of the way the neurons are connected. The more people stay intellectually and socially engaged. And physical exercise, we should emphasize, is also very, very important.
It's like the baby in the crib making an impact.
So, Marvin, how do you feel about getting old?
I'm okay with it. I mean, as long as the body is working, and I'm working on that because I've been having some bodily problems that are better now. So it's a relief. I can look at the sky, at the lake, without apologizing. It's different. It's different, and in a positive way. And I see things differently. There's a line from T.S. Eliot that I've always been captivated with. And maybe we can end it with that. Okay?
Good.
Okay.
Enjoy your golden years, Marvin.
What's that?
Enjoy your golden years as I hope you enjoy mine.
Well, I enjoy our conversations. This is fun. This is good. And you know how much we're earning from this?
We're earning a lot of self-satisfaction.
Absolutely. So what T.S. Eliot wrote was, we will not cease from exploration. And at the end of exploring, we will arrive where we started and know the place for the first time. See you next week.
You too.
Bye.